Welcome to Legs Like Mine, the podcast, where we explore lipedema through the eyes of a patient, break down the latest research, and share real life stories of living with this often misunderstood condition. I'm Susan O'Hara from legslikemine.com. I'm a lipedema patient, author, and advocate, and I'm so glad you're here. Whether you're newly diagnosed or deep into your journey, this podcast is for you. Today, we're talking about a brand new study that should concern every single person living with lipedema and everyone who works in healthcare. This research, published in 2024, is titled Lipedema Awareness and Knowledge Level Among Medical Doctors in Turkey, a cross-sectional study. Now, before you start thinking, Turkey, that's not my healthcare system, stick with me, because this isn't just about Turkey. This is a wake-up call for the global medical community. The study in a nutshell. The researchers surveyed 508 medical doctors in Turkey across a variety of specialties. These were real practicing physicians, from newer doctors to those with decades of experience. Here's what they found. Only 51% of physicians had ever heard the word lipedema. That's barely half. Let that sink in. Only 29.9% had ever seen or referred a patient with lipedema. That means over 70% of doctors likely never recognized or treated someone with this disease, or they missed it entirely. When asked about specialized lipedema clinics or treatments, more than half said they had, quote, no idea. So what does this tell us? It tells us what many of us already know from lived experience. Lipedema is still largely invisible to the very people who are supposed to help us. What does this mean for patients? Let's break it down. If only half of doctors recognize the word lipedema and fewer than 30% have ever treated someone with it, that means we as patients are too often left to diagnose ourselves, search for experts on social media, beg insurance companies for coverage, and build our own treatment teams. Sound familiar? It should. I've done it myself. I live in Oklahoma. When I started suspecting I had lipedema, I had to tell my own doctor about the condition. She'd never heard of it. From there, it was all on me. I coordinated my own pre-op testing, battled with insurance for coverage, traveled to California alone for surgery, stayed in an off-site and self-arranged nursing facility, and then a hotel, fly home alone, and then had to find my own certified lipedema therapist for aftercare, someone who was unfamiliar with post-op lipedema protocols. There was no one person overseeing my care except me. No one saying, here's the path, here's the plan, we got you. And fortunately, I know I'm not alone. The study's conclusion is that we need change. The Turkish study ends with a clear message. We need to incorporate lipedema education into medical school training, continuing education, and national clinical guidelines. We also need to establish multidisciplinary care models that actually serve the full spectrum of patient needs. This isn't just a nice idea, it's urgent. The earlier we catch lipedema, the better we can manage it. But how can we expect early diagnosis when most doctors don't even recognize the signs? So here's what we do. If you're a patient, a caregiver, or a healthcare professional listening right now, go to AmericanLipedemaAssociation.org. That's our home for advocacy, education, and pushing this movement forward. Let's demand better education for medical professionals, real clinical pathways, recognition of lipedema in every U.S. state and beyond, and full spectrum care from diagnosis through lifelong management. You can also download our physician one-pagers and toolkits to bring your providers and start conversations that might not happen otherwise. This might be one of the most important conversations we've had on this podcast, not just about research, but about why we have to keep pushing, keep educating, and keep speaking up. You can help. Share this episode, send it to your doctor, talk to your elected officials, become part of the change, because we all deserve to be seen. If this episode spoke to you, or if you've ever felt unheard on your lipedema journey, please know this: you are not alone. We're in this together, and we're not stopping here. Drop a comment below. I'd love to hear your thoughts. And don't forget to like and subscribe so you never miss an episode. Thanks for listening. I'm Susan O'Hara from LikeMine.com. Be kind to yourself and keep going.